I recall meeting a family and they were newly diagnosed with von Willebrand's disease and sitting and talking to, by the way, there was three generations around. There was a daughter, a mother, and her mother. And sitting there talking to them, the grandmother and the mother would kind of explain that, but listen, there's nothing wrong here. This is the way we live in our family. We always bleed a lot. We get really, a lot of bleed events. And, when we have our menstrual periods, they are heavy and they are long. But that's just the way we live. This is how we are. And not necessarily knowing that you don't need to be, this could be very, very different. So although we are now in 2025 and you should think everybody will kind of know what is normal and abnormal, we will still find a lot of people that lives with a substantial disease burden, not necessarily knowing that this is not normal and it doesn't have to be this way. A lot of people don't necessarily even know that this is not normal. And two, as a result of that, it is almost impossible to be creative and think about ways of managing this that could completely change life. So I think many people who are, and there are many people who are very knowledgeable about the bleeding symptoms with von Willebrand's disease, even those people are like, but is it really possible to think or expect or demand or wish for a treatment that is given subcutaneously once a month and then, potentially changes the entire experience with that disease? There are patients that are very knowledgeable. Even the most knowledgeable would not necessarily always know what you can possibly ask for because it goes beyond your imagination. And then there's a subgroup of people living with the disease thinking that this is just the way life needs to be. It is not just giving them hope and giving them attention by saying, no, it doesn't have to be. Can you imagine, that's step one, and then potentially give them a whole new way of managing that. That would be fantastic.